different folks from different sectors of community advocacy, leadership, healthcare, and it was really powerful to hear some of the stories of things that are happening in our community. One that I really want to highlight that I think is something that we should think about in our thing, and I think about Ms. Diaz coming and talking to us about our healthcare system, which is a disaster at best in most of the time. In this context, what folks were really focusing on was the Otero County Hospital merger and the effects of a religiously oriented institution taking over the lone healthcare provider for a lot of people in that county. And I do just want to sort of point out that Las Cruces, we are lucky to be, a place where we have a number of healthcare providers that don't discriminate and don't have an orientation toward or against reproductive health and trans healthcare. And I just want us to all recognize that we're going to have folks coming, those folks who can cross the federally constructed, which, as we reminded Mr. Vasquez, Border Patrol checkpoint that creates a literal physical barrier. Those folks who can get past that will be coming to Las Cruces to get care, in particular related to reproductive health, in particular related to gender-affirming care. And so that was one of the big topics that we discussed in that context, and I think that he's really attuned to it, and I appreciate that Las Cruces continues to be the place where we can make those things happen, and we're thinking about it. But it does tie into Ms. Diaz's public comment and how we are dependent on the providers, for-profit, nonprofit, if you're lucky enough to have those, and their orientation in serving the community. And I do think it's a huge issue. I don't know that we're the place to solve it, but I appreciate that our city continues to be the place where people can come and receive the care that they need. And Congressman Vasquez says, hey to everyone.
Tell him hey back. Okay, Councilor Bencomo.
Thanks, Mayor. I don't have much today.